Hello, my name is Dr. P. I am a senior medical doctor. Recently, there have been reports of deaths from snakebite. Today, I want to calmly explain everything you need to know. I will use simple language so you can protect yourself and your loved ones. In this first part, we cover the basics of snakes and bites. First, let us clear a common fear. There are over 3,000 types of snakes in the world. Only about 600 produce venom. Fewer than 200 have venom strong enough to seriously harm or kill a human being. Many snake venoms cause only mild effects. Snakes developed venom mainly to hunt small animals, not to kill humans, so not every snake bite is deadly. There are two main types of snake bite. A. Dry bite, where no venom is injected, and B. Venomous bite, where venom enters the body. A dry bite often happens when a snake is suddenly stepped on or frightened. The snake reacts quickly out of fear. It bites without preparing to inject venom. No venom enters the body. The snake just wanted to run away. A venomous bite happens when the snake feels threatened and prepares to defend itself. This is when serious illness can occur. The snake pulls venom from its gland, mixes it with saliva, and injects it into the person's body during the bite. Let's look at how different venoms affect the body. Different snakes affect the body in different ways. Some venoms affect the blood and cause bleeding. Others affect the nerves, causing weakness or breathing problems. Some damage the muscles or destroy skin and flesh. Some venoms may only cause mild swelling and pain, but all bites must be taken seriously. If someone is bitten, stay calm. Panic makes venom spread faster. Keep the person and the bitten limb still. Place the hand or leg at the same level as the heart or slightly lower. Do not lift it too high. Go to the nearest hospital immediately, especially one that has anti-venom. Do not wait for symptoms to worsen. Now, let's discuss what not to do. These mistakes can be very dangerous. Do not tie a rope or cloth tightly around the limb. Do not cut the wound. Do not suck the venom. Do not apply chemicals or herbs. Most importantly, do not delay. We dive deeper into why some common first aid remedies are actually life-threatening and why speed is your greatest ally. A very common belief is that tying a rope or cloth tightly will stop the venom from spreading. This is a dangerous misconception that can cause more harm than the bite itself. When you tie a limb tightly, you stop all blood flow. This starves the flesh of oxygen. Within a short time, the tissue begins to die, a condition known as necrosis. Tying traps the venom in a small area. Instead of diluting, the venom becomes highly concentrated, rapidly destroying the skin and muscle around the bite site. This concentrated damage often leads to permanent disability. In extreme cases, doctors are forced to perform an amputation because the limb is too damaged to save. Furthermore, when that rope is finally removed, a sudden, massive rush of venom and toxins enters the heart and organs, which can cause the patient to go into fatal shock. The only correct action is to keep the hand or leg completely still, not tied. Movement is what spreads venom, so keeping the limb quiet is the best first aid. Now, let's talk about the golden hour. In toxicology, we say time is tissue and time is life. Every minute you wait allows the venom to do more damage. According to the World Health Organization, reaching a hospital within minutes is ideal. The first 1 to 3 hours are the most critical window for effective treatment. Anti-venom works best before the venom has permanently bound to your nerves or blood cells. Once that bond happens, the damage can become irreversible. Waiting longer than 6 hours dramatically increases the risk of severe internal bleeding, respiratory failure, and permanent kidney damage. Venom mainly travels through your lymphatic system, which moves when you move your muscles. This is why stillness and speed are so important together. There is no such thing as a safe waiting time. Do not wait for symptoms like pain or swelling to worsen. By then, the venom may already be causing organ failure. Go to the hospital immediately. It is better to arrive and find it was a dry bite than to wait and arrive too late to be saved. Warning signs of snakebite and venomation from head to toe, so you can recognize an emergency before it's too late. Warning signs often start in the head and face. Watch for severe headaches, dizziness, confusion, or a sudden fainting spell. These are signs the venom may be affecting your brain. Neurotoxic venom often causes ptosis or drooping eyelids where you cannot keep your eyes open. You may also experience double vision or difficulty seeing clearly. The venom can paralyze the muscles in your throat, making it difficult to swallow. Your speech may become slurred, and your voice might sound weak or husky. In the chest, you may feel a painful tightness. Breathing can become difficult and shallow as the venom weakens the muscles used for respiration. In severe neurotoxic cases, the breathing can stop entirely. This is a life-threatening crisis that requires immediate hospital mechanical ventilation. The digestive system also reacts. Intense nausea, repeated vomiting, and sharp stomach pains are common systemic responses as the venom circulates. At the site of the bite, expect severe pain and rapid swelling that spreads up the limb. You may also see bruising, blisters, or the skin beginning to turn black. Certain cytotoxic venoms destroy the skin and flesh directly. Loss of movement in the hand or leg is a sign of deep muscular or neurological damage. Hemotoxic venoms attack the blood's ability to clot. You might notice bleeding from your gums, spontaneous nosebleeds, or unusual bruises appearing on your body. Critical signs of internal bleeding include finding blood in your urine or stool. This indicates that the venom is causing systemic hemorrhaging throughout your organs. Finally, the kidneys are often under attack. Passing very little urine or urine that is dark and bloody is a sign of acute kidney failure. This is a medical emergency. If you notice any of these signs, not just one, but any of them, you must reach a hospital urgently. Do not wait for more symptoms to develop. Early detection of these symptoms allows doctors to give anti-venom before the damage becomes permanent. Your awareness is what will save your life. Today, we address a common question. Why isn't anti-venom given the moment you reach the hospital? Many people ask for anti-venom immediately, but there are vital reasons why we wait. Not all snake bites inject venom. Some are dry bites that require no treatment. Anti-venom is a powerful biological medicine, but it can cause severe, life-threatening allergic reactions. Giving it when not needed can harm the patient more than the bite. Furthermore, anti-venom is expensive and often in limited supply worldwide. We must ensure it is used for the patients who truly need it to survive. Doctors only give anti-venom when clear signs of envenomation appear, such as rapid swelling, severe bleeding, or difficulty breathing. These signs show the venom is active. It is always given in a hospital setting under extremely close monitoring so that medical teams can react instantly to any side effects. Anaphylaxis is a rapid reaction that can cause the airway to close and the patient to go into shock. This is why anti-venom is never given at home or in the field. Some patients experience serum sickness days or weeks later, suffering from fever, rashes, and joint pain as their immune system reacts to the anti-venom proteins. If not treated early, snakebite can cause permanent kidney failure, severe internal bleeding, and lasting damage to the muscles and skin of the bitten limb. In the worst cases, amputation is necessary. Early treatment is the only way to avoid these devastating long-term complications. Treatment saves lives. My final message is this: snakebite is a medical emergency. Do not rely on local remedies. Do not tie a rope. Do not delay. Go to a hospital immediately. If you found this series helpful, please like, share, and follow Dr. P for more clear and trusted health education. Your support helps us reach more people. For more information, please visit the World Health Organization links provided in the description of this video. Knowledge is power when it comes to your health. Thank you for watching this series on snakebite awareness. Stay safe, stay informed, and I will see you in the next video.